has been interested in doing PRP injection for at least 7 to 10 years, but the technology has been present for about 30 years. It became popularized initially in Europe and then gradually worked its way to the United States. PRP stands for platelet-rich plasma. We take the patient's blood and centrifuge it, and in doing so, concentrate the platelets. Then we aspirate the platelets. We have a special tube that separates the platelets and plasma from blood and white blood cells, which actually cause inflammation. But the platelets and plasma both have significant healing factors. They have anti-inflammatory factors, which are well known, and they're then concentrated. So what PRP does when it's activated, it releases these vesicles containing these proteins that promote healing. They actually start the cascade for healing. So, for example, in a tendon, they would instigate hypertrophy or healing of the tendon injury. They bring healing cells to the site. In a knee joint, it's been shown to actually increase the production of hyaluronic acid, which is a joint fluid. And people go in to get hyaluronic acid injections, which are synthetic. But when you do PRP, it's naturally increasing the hyaluronic acid in your own knee joint. And that produces additional lubrication to the joint. Not only does that, it also is a signaling process in that it may signal the recruitment of mesenchymal stem cells to the joint. And mesenchymal stem cells are cells that actually promote regeneration of tissue. Beyond that, it has not only anti-inflammatory, but an antibiotic factor in that it reduces risk for infection. So there's very, very low risk of getting an infection with a PRP injection because it actually has antibiotic properties in the PRP. So it's injected in the area of the inflammation, whether it be the knee joint, into the tendons, such as elbow tendonitis, to reduce pain, or in the spine, we inject sometimes joints or even the disc to promote healing. I have given the late Kobe Bryant a lot of the credit for popularizing it because he was a well-known basketball star, and he went to Germany to receive PRP injections for his knee. And not only did that improve his symptoms, they had told him he may not be able to play, but he returned the next year, and all of his stats actually significantly improved, and he did not require surgery. So this then led many other sports figures to go to Europe. And then I think that the American doctors became interested in this technology, which had been available for a while in Europe, and they pursued it. And then it's gradually caught on, and now it's like wildfire. It's widely used in the United States to treat sports injuries, knees, shoulders, commonly elbows, but also we see it used in treating spinal injuries.
Yeah, and to build off of that, it's also used for chronic pain conditions, chronic overuse conditions. So there's great evidence for PRP and lateral epicondylitis, which is commonly termed as tennis elbow. So that's from overuse of your wrists and elbows. It's shown to be superior to steroid injection. So it really has so many different areas of benefit, not only in acute sports medicine applications, chronic sports medicine applications, but also just like the everyday person.
I should add that our co-presenter, Dr. Roya Moheimani, is actually a contributing author of a textbook on PRP and stem cell injections. And maybe she can tell us about her chapter in the book that she wrote and some of the conclusions that she arrived.
So the chapter that I talked about was what optimizes patient outcomes with PRP injections. And the chapter really touches on the fact that a lot of the studies that have been done in young, healthy patients, and there's been a really good response. So obviously, when you're young and healthy, your cells are the most robust, or your growth factors are most robust. However, that doesn't mean that if you're not a young athlete that you don't benefit from PRP. But certainly, in order to make your PRP experience as successful as possible, you want to engage in things that don't interfere with platelet function. So the chapter kind of talks about what are things that may interfere with your platelets, and a very common example is smoking. So if a patient's considering a PRP injection, I would highly counsel against smoking cigarettes, and that's an exclusion criteria for pretty much all the studies with PRP. Another thing that our chapter kind of touches upon is there's no real discussion on how does diet affect the PRP injection, meaning do they control for diet in these studies? And they don't typically control, but from a theoretical standpoint, it would make sense that a more anti-inflammatory diet would probably be beneficial to give cells and the growth factors the best chance of working. So we kind of touched upon that. And then, obviously medications can affect platelet function. So pretty much all papers will talk about these drugs called nonsteroidal anti-inflammatory drugs. And those are like your ibuprofen, Motrins, or naproxen, Aleve medication. And so in our clinics, we usually recommend holding that for 6 weeks prior, and then for 2 weeks prior, and then holding it for 6 weeks after the injection during the process, because we want to keep those platelets as robust as possible.
So one thing that we do, I've been experienced in, we've done a great number of injections for the shoulder. We typically use ultrasound, which will help guide us to doing the injection properly. We usually inject some in the subacromial space over the tendon, and we usually will inject the tendon directly where it's injured to promote healing of the injured tissues. We've had great success with that, with significant reduction of pain. My own experience has been that the need for shoulder surgery, specifically shoulder arthroscopy, has significantly dropped because many of our patients improve and don't need surgery. Similarly with knees, it's quite helpful with early arthritis of the knee, but we've also used it for more subacute injuries. We've used it for meniscal tears. So many times individuals have pain with a meniscal tear, but necessarily no instability. They don't really need surgery. The PRP will help promote reduction of the inflammation, recruit healing factors to the knee joint with substantial reduction of the pain, and again, reducing the risk for the need for surgery and allowing patients to return back to their work activity or sports activities more spontaneously. In the spine, I've had great experience in doing disc injections with PRP. Again, it is considered somewhat controversial, but there are many, many papers that actually indicate great success with this procedure. We inject a small amount of PRP into the disc, and again, the elements such as the plasma help to seal any annular fissures that may be present. The PRP itself, again, promotes or places healing factors within the disc and promote potential hydration with increase in hyaluronic acid and other healing factors in the disc space. So we've also found it very effective in disc infections. It can also be used for soft tissue injuries, such as an ankle sprain that's not healing well, or a muscle strain. We can actually directly inject the area, and it promotes healing. We've also had some experience with areas of bone marrow edema. So if you had direct trauma to the joint or avascular necrosis, we've injected PRP and sometimes stem cells into the area of bone injury, and it can help promote healing of the bone injury successfully.
Yeah, and the really exciting thing is that it's your own body that you're using to make the injectate, which I think is really what makes it attractive. A lot of people are all about being holistic and natural. Well, is there anything better than using your own self? Like, we draw the blood for PRP, we spin it down, and we take out that area that's regenerative and inject it. When we're doing stem cell, we harvest your own stem cells and use that to do the injection. Conventionally, people would be injected with steroids, and steroids theoretically been shown to cause actually further degeneration. So having this available therapy is super exciting, especially in the sports medicine, chronic pain, avoiding surgery realm.
Been shown to be very effective in osteoarthritis of the knee. In fact, commonly used are steroids, but recent studies indicate that actually steroids may expedite or increase the progression of knee arthritis. And so, although the patient may experience temporary benefit, in the long run, you're actually producing harm because it actually may kill the cartilage cells and actually expedite the arthritis, which means advance it further. And there are several studies that point to that. Viscosupplementation has been used, which is basically a synthetic lubricant in the joint, and we offer that and have noted significant improvement, uh, particularly with mild to moderate osteoarthritis. But again, there are many studies that show that head to head, if you do PRP versus viscosupplementation, that the PRP injections are more successful and provide better relief of pain. Uh, 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 Unfortunately, at this time, uh, uh, many insurances don't cover PRP injections for the knee or shoulder. Particularly, it's not covered by Medicare, and most PPOs don't cover it. We do workers' compensation, and that is hit or miss. We are able to obtain approval for PRP injections uh, for that, and then many patients, once they understand the benefits, are willing to pay and get the treatment on a cash basis. We offer actually very reasonable price, and many patients procure the treatment by just paying for the service on a cash basis. We really think that based on significant success and multiple uh, uh, scientific results, that at some point that the PRP will be approved by the insurances, but currently it's not.
Would you do it for a patient with like severe osteoarthritis? I think it's tricky. I think that PRP intra-articularly, if it's a weight-bearing joint specifically and the osteoarthritis is severe, its chances of success are, in my experience, lower. And that's when like surgery is definitely what we might be steering towards. But for patients that are not ready for surgery, they're too young for surgery, because you have to remember joint replacement's usually the next step. If you're 45 and you have severe arthritis from playing sports, maybe you don't want to do a joint replacement. A PRP or a stem cell treatment might be a good, try it and see kind of what your efficacy is. Given that you're young, you have the best chance with the injection in that sense. But for patients who have moderate to severe and are a little bit older, it's if you have hesitation, maybe you're not cleared for surgery. That's where I see PRP being stem cell therapies being very helpful.
Yes, generally, results of PRP in knee osteoarthritis are better the less severe the arthritis is. When it's very severe, bone on bone, chances of success is lower, but certainly not zero. And so, if someone wants to avoid surgery, it's certainly reasonable to try a PRP or even a bone marrow concentrate or stem cell injection um, as a way to avoid surgery. There's one other option that Dr. Roy talked about, which is what we offer, and those are genicular nerve blocks. So we actually inject the nerves of the knee joint, and sometimes that can provide some additional temporary relief. Eventually, the knee replacement will be necessary, but will allow the individual to put time off. They may be not a good candidate for knee replacements, such as extreme obesity if you're very overweight. The risks are higher with surgery, and the results are not as good. And so you may want to consider these alternative procedures, such as PRP injection, stem cell, or nerve blocks for the knee joint. Uh, and the genicular nerve blocks are uh, authorized by private insurances and Medicare. I would sometimes early on, 7, 10 years ago, would get comments that it's experimental and not well proven. I don't get those comments now. I think it's widely accepted form of treatment. It's used widely across the country and even worldwide. It's a very popular form of treatment, whether it be in Europe, Asia, uh, and even non-developed countries. And certainly in the United States, it's now widely accepted as a uh, very good alternative form of treatment to traditional treatments, which included steroid injections.